Hi, I'm so glad you're visiting my page. Here's why I think you may want to consider the one-time consultation. Most of the women who come to me know that something's wrong with their sex life. They can list a whole bunch of things. They're kind of not interested in sex. They maybe have some pain, but they're not having orgasms the way they want. They're not getting aroused. Things are kind of a mess. Things are tense between them and their partner, all those things. They're kind of not sure where to start. Like, is this a physical problem, whatever, or is it a psychological problem, whatever? Like, I don't know how to talk to my partner about it. We do talk about it all the time, but we're getting nowhere. A one-time consultation will help you figure out what the problems really are. Like, I will help you figure it out. I often use the analogy of patients who kind of dump a plate of spaghetti on my desk, and slowly together we pull apart the strands. You'd be amazed at how quickly I can help you sort of define, articulate really kind of where the problems are and how they stack up against each other. Then, and I think this is the key, where to go for solutions to the problems may be quite different than what you think. People sometimes think, oh, I guess I should start with a sex therapist because it's a sexual problem, but the issue is that some of the problems you're having may mean going to your gynecologist. Maybe you tried your gynecologist, but maybe you actually need an endocrinologist, or maybe you don't need an endocrinologist, you need a primary care doctor. And on top of that, you also need some books, some information, some toys. And on top of that, or in a side, or instead of that, you may need actually a sex therapist. But when you say a sex therapist, it could mean so many different things. There are sex therapists that deal specifically with trauma. There are sex therapists that deal specifically with body images, things. There are couple sex therapists that do sex. Not every sex therapist does trauma and couples and body. Not every sex therapist is good at doing educational information with you. Not every sex therapist is good at doing sort of history, family history issues. So what you need is something very specific. And I often see people kind of end up with a sex therapist and they end up talking and not getting anywhere. Or they go to a medical provider and it's not the right medical provider. And even though they may fix part of the problem, they can't seem to integrate it into their sex life with their partner. So what I think a one-time consultation can do that is unbelievably helpful for you is you'll meet with me, we'll talk about the presenting problem and a little bit about your history, and I will help you kind of make sense out of that and guide you as to the right kind of help you need, so you don't get locked into a therapy that could take you months and months and not be what you need. I hope you'll consider doing a one-time consultation. I love doing them with people. People find them incredibly helpful, and I look forward to meeting with you. If you are interested in a 10-minute quickie just to see if you're right for a one-time consultation, you can set that up as well.